Hi, my name is Trevor Jones here at Healthworks Rehab and Fitness in Morgantown, West Virginia, and today we're going to take you through our evaluation and treatment process for concussions. So I'll typically see patients anywhere from 3 to 4 weeks status post-concussion up to months or even a year or two after concussion. So we have our patient Kristen here who's going to take us through a little bit of our brief exam, and then we'll show you some treatment. So the first thing we're going to do, Kristen, is we're going to look at some of your eye and head movements. So what I want you to do is follow my finger with your eyes, keeping your head still. So throughout this process, we're watching that Kristen's eyes track nice and smooth. We're looking for what's called nystagmus, or involuntary twitches of the eyes. And then we'll also assess for symptoms with this. So the smooth pursuit system is useful for reading and different lower level activity tasks. So the next thing we're going to do, Kristen, keeping your head still again, look back and forth between my two fingers as quickly as you can. So again, we're looking that she's nice and quick. Smooth transitions, let's go up and down. Then we're going to look to make sure she hits her target. So if she misses the target, that's something we can work on. Good. So everything looks good there. Next, we'll move on to our infrared goggles. So these infrared goggles allow us to record eye movements without fixation. So she won't be able to see while she has these goggles on. So Chris, I'm going to have you hold these. Put those on for me. Now, Kristen, keeping your head still, what I want you to do is look to the right with just your eyes. Perfect. So we're looking, her range of motion looks good. Come back to the middle. Then look to the left. Good. Come back to the middle. So there's no nystagmus there. She reaches the end range and everything looks pretty good. So Kristen, you can go ahead and take those off. We'll take her through all the different directions and the different motions as she's coming in for the evaluation process. So I'm going to hold these, Kristen. What I want you to do is scoot down this way and then swing your legs up onto the table. So the next part of our evaluation has to do with ruling out positional issues like BPPV. So that stands for benign paroxysmal positional vertigo. So a lot of people think of this when they say their crystals are out or they have vertigo. This is a condition that can also come along with head trauma. So here are the goggles, Kristen, again. So go ahead and put those on. Don't lay back quite yet. Turn your head to the right and lay all the way back down for me. Good. Come down, down, down. Perfect. So while Kristen's in this position, I'm just watching her eye movements. So we'll typically see a torsional upbeating nystagmus, which means the eyes are turning and going up at the same time. And we're also assessing again for Kristen's symptoms. So if she has a spinning type sensation, that's typical of BPPV. Okay, Kristen, go ahead and sit back up. Very good. You can take those goggles off and you can swing your legs back around. All right, so we've gone through our basic eye and head movement screening. Now we're going to go over here to what's called our neurocom, so it's a balance system. So Kristen, let's head on over. So you're going to stand in the middle of the force plate there, facing the computer screen. All right, so let's put your hands on your hips and then balance as still as you can. So our first test is with Kristen's eyes open. We'll get this in degrees per second so we can actually quantify some of the data, and just instead of just saying somebody's able to balance for 30 seconds. We'll have degrees per second sway. And then our next condition, go ahead and close your eyes. So the eyes closed balance is typically more challenging for our patients, and then we'll have a foam balance test later on as well. So we can do a couple different balance tests on this system, one typically for younger patients, and then anybody about 25 and older, we have another test. All right, so Kristen, you can come off of the balance board there, and then let's head over to our BIT system. So our BIT system analyzes again, different eye movements, and this we can actually bring in the cognitive function to some of these tests as well. So I'm going to give Kristen the stylus here. One of our kind of basic tests is what's called trail making. So she's going to start off just making trails. So you're just going to do connect the dots with all the numbers 1, 2, 3, 4, and so forth. All right, so Kristen's basically using what we call saccadic eye movements to track and find the different numbers. So this one's a fairly basic concept. And then Kristen, go ahead and hit a wrong number for us. So she'll get feedback if she hits the wrong number or goes out of order. And then she can just go through the rest of the process here. Again, we're assessing for accuracy, speed. This is going to be setting our baseline. So we try to do this type of test on the first or second day of our process here. And so we'll set this as our baseline for our reevaluation process later. Good. So Kristen's finished. As we can see here, it took her 47 seconds with one air, and we also have the direction that she went in. So we'll have this saved as our baseline, and we can go back and compare our results later on. So when we get into the rehab side of things, we can do a few different things. One of the more challenging things, bringing the cognitive component into our saccadic eye movements, our gap sequence. All right, Kristen, we're going to have a rotating wheel on here with numbers. You're going to start at the lowest number and work your way up, but there may be gaps. So you might have 1, 2, 3, and then 7, so just go to the next lowest number. So go ahead and hit that middle button there. Okay. So now, in addition to using our smooth pursuits and saccadic eye movements, we're bringing in the cognitive aspect as well. And so we can make the rotator faster, we can make the numbers bigger or smaller, we can go in reverse order. So there's a lot of different things we can do to bring in the cognitive aspect, which a lot of people have difficulty with after concussion. That's our concussion evaluation and some of our treatment ideas here at Healthworks Rehab and Fitness.